Thank you, Simon. Hi, good afternoon, everyone, and welcome to the NPA Conference. Thank you for joining us for this session on COVID-19 and risk assessments for at-risk staff. So I'm Jasmine Shah. I'm the Head of Advice and Support Services and the Medication Safety Officer here at the NPA. And I'm very pleased today to be joined by our guests, which is Duncan Rudkin, the Chief Executive of the General Pharmaceutical Council, Laura Chalkley, who's the Head of Team and Solicitor at Ellis Whittam Limited, who's also joined by her colleagues Andrew Hall, the Regional Health and Safety Manager, and Nick Wilson, who's the Director of Health and Safety Services. So if I can show people the agenda next, Simon, which is welcome of agenda and speakers for today. Thank you, Simon. And we also have Simon Wills from the NPA supporting us on the tech side. So thank you for that, Simon. So here's our brief agenda for today. Just saying my hello and welcome to everyone. I've introduced the speakers to you today, and Duncan Rudkin is with us initially to set the scene for risk assessments from the regulator's perspective, and he'll take some Q&As. He's with us till 12:50, so we will ensure that the GPAC session is completed by then before we move on to the rest of the agenda from the NP and Ellis Whittam perspective. So thank you for that, and over to you, Duncan.
Good afternoon, Jasmine. Good afternoon, everybody. Okay. And thank you for the opportunity to join you at your conference. I hope that you can all now hear me, and what I wanted to do at the start of your session was really just to do a bit of a scene setter and focusing on why, from the GPHC point of view, why we think risk assessments are so important for your staff and the approach we'd like to ask you to take. I'm not going to go into the detail of how or the legal framework, because I know you've got some experts on the session later on who are going to cover that. But I do want to set the scene really with a few key principles about why risk assessments for your staff are so vital. The starting point for all of this from my point of view, from the regulatory point of view, is the standards that we set for registered pharmacies. You'll be very familiar with these from the point of view of patient safety, but I want to draw attention to the fact that the principles and the standards that we set out in the standards for registered pharmacies, which are the yardstick against which we inspect all pharmacies, also really depend across the board on keeping your people safe as well as your patients. The standards for registered pharmacies all essentially come down to 5 key principles, which is worth highlighting really as part of the setting the scene. Principle 1 is about having in place governance arrangements which safeguard the health, safety and well-being of patients and the public. And I want to say right at the outset that from the regulator's point of view, it's impossible to see how we can be safeguarding the health and safety of the public if we're not also safeguarding the health and safety and well-being of our colleagues working in pharmacies, you and your teams, essentially. You can't keep the public safe if you're not safe yourselves. Principle 2 requires pharmacy owners to ensure that staff are empowered and competent to safeguard the health, safety and well-being of patients and the public. And that's about giving people information and knowledge and also authority to do the right thing. And risk assessments are a crucial part of that as well. Principle 3 highlights the important role of the environment and the condition of the premises and how these are fundamental to patient safety. And again, the point is, I think, very obviously there, that you can't have an environment that's safe for the public if it's not also safe for your staff. Principle 4 highlights the way in which pharmacy services are delivered and organised, focusing on arrangements for delivering services. And again, just to labour the point, although the obvious focus from a regulatory point of view is on patients and the public, it's literally impossible to have services delivered safely to the public if staff are at risk. And finally, principle 5, which is about equipment and facilities. I think when we're thinking about how we can keep ourselves and our colleagues safe in the COVID context, having the right equipment, using it in the right way is obviously an important part of that too. So I just thought it was important to take a couple of minutes to go through those regulatory principles which sit right at the heart of our standards for pharmacies and our inspection work, to illustrate how they really bring home the important role of risk assessment in keeping staff safe, but also in upholding and achieving the regulatory standards. There isn't a choice, I don't think, between meeting the regulatory standards and keeping staff safe, including assessing risk. It seems to me that given the expertise and competence of your profession, that actually risk is right at the heart of pharmacy practice. The assessment of risk around medicines, the opportunity to do good using medicines, and your expertise around all of that, both on the risk side and on the opportunity side, seems to be right at the heart of pharmacy as a profession and your identity. So I think pharmacy as a profession and you as leaders within pharmacies are well placed to really be exemplars of good practice when it comes to risk assessments for healthcare staff. There is, of course, unfortunately, some evidence that in the early stages of thinking about risk assessments, we haven't necessarily seen the level of practice that we would be looking for. There was some evidence, as you know, that I think is important to highlight, that was published by the Royal Pharmaceutical Society and the UK Black Pharmacists Association, who carried out a survey which reported in June. So 25th of June, all the detail is there on the RPS website if you want to check it out. But the headline was quite disturbing. The headline was that at that time, towards the end of June, more than 2/3 of Black, Asian and minority ethnic pharmacists and pre-registration trainee pharmacists had not yet had these important risk assessments. And that was nearly 2 months after the NHS first asked us all to do them. And when we look at that, we also need to bear in mind that the concern about risk is very real. The same survey highlighted that 78% of Black pharmacists and pre-registration trainees believed that they were at greater risk in relation to COVID-19 and that changes to working practices were required. A significantly higher proportion than was the case with white colleagues. So there is that concern about risk. There is now a body of evidence about risk from Public Health England and others, which highlights the importance of focusing attention on risk assessments. Now, for obvious reasons, I think in terms of priority, there's been a focus on working on risk assessments for staff who may be at greater risk. I think one of the challenges is if we haven't done the risk assessments yet,
Jasmine, I believe we may have
NHSE&I has made clear its
no.
reporting requirements in relation to risk assessment. So there are all sorts of regulatory reasons why risk assessments are important. There is evidence, as I said, that the practice has not so far been quite where we would want it to be. And I think that's one of the reasons why I would encourage you from a regulatory point of view to be thinking about how you're doing your risk assessments. There are lots of tools available, lots of resources available. And I think later on in the session, I would expect that you'll be introduced to some of those. NPA, along with a number of other organizations, have done fantastic work in pulling together really useful resources. And we at the GPHC, in terms of the risk assessments for our own staff, are drawing very heavily on those resources too. So thank you to NPA and others for that. But I want to make the point, as with all resources that you might use when it comes to meeting the regulatory standards, that the templates that you can find on websites, those toolkits are really useful resources. But it is, of course, essential that they're applied in the context. The standards for registered pharmacies highlight, of course, that each pharmacy is different. The nature of the team, the individual issues that team members are experiencing are different. The pharmacy context, physically, with the physical environment, and the services and the wider community that that pharmacy sits within. These are all different aspects of context, which mean that any kind of off-the-shelf resource, whilst it's a useful starting point, has to be adapted and applied intelligently. So there isn't going to be a sort of off-the-shelf risk assessment that we can simply say, that's the job done, I've printed it off. We really need to be working through it, taking account of all of the issues around the context and having those individual one-to-one conversations that sit at the right at the heart of risk assessment. The other point that I wanted to highlight at the beginning, Jasmine, and I think it's worth mentioning up front because it's something I've been asked about quite a lot, is in relation to locums and more detailed questions about specifically who should be having risk assessments. I think it is right to highlight that anybody that's working in your pharmacy, you ought to be thinking about doing a risk assessment with them and for them. Of course, under health and safety legislation, employers have particular responsibilities to their staff, to their employees, and some of our colleagues on the session may be able to speak to that later on in more detail. But it's also worth highlighting that, of course, as businesses, we all have responsibilities to anybody attending our sites, and that includes your pharmacy sites. And workers generally in your environment, I think, whether they're employees, strictly speaking, or locums, self-employed locums, for example, I would argue you ought not to be treating them differently when it comes to risk assessment. Because whether or not they're your employees, they are workers in your environment. There is, at the very least, a public liability obligation, and I think more widely an obligation to make a safe working environment for those locums as well as for your own staff. And I'll finish by coming right back to the point, Jasmine, that I made right at the beginning, which is that for pharmacies to keep patients and the public safe, it's part and parcel of that, I think, to keep staff safe. And risk assessments are an essential way of doing that, and also an essential way of demonstrating, by conducting those risk assessments and documenting them, an essential way of documenting that you're meeting both your legal obligations and also your regulatory obligations under the GPHC standards. So I've set out what I think is the regulatory case for conducting risk assessments. I've highlighted some evidence that there is work to be done in terms of improving the level of completing risk assessments. And I've said a little bit about how I think it's important to use off-the-shelf tools in a thoughtful way that makes sense in the individual context. When it comes to how are we providing assurance across the board that risk assessments are taking place appropriately, then I think there are a number of ways in which the whole system can do that through the reports that you provide to NHSE&I in response to their surveys, but also through our inspection work. GPHC inspectors have throughout the pandemic been following a supportive approach, doing lots of phone calls as well as some physical visits. We're starting to do a few more physical visits. We'll continue with the supportive phone calls approach as well. We want to be there to help and support with advice, and also sometimes support by asking questions. And where we find good practice, we're keen to highlight that. We have identified over 100 examples of good practice throughout the whole pandemic on a whole range of topics, which we've published on our inspection site, including recently something around good practice with regard to risk assessments. So it's always worth checking in there if you're looking for kind of reassurance that what you're doing is heading in the right lines. Our inspectors will, if necessary, challenge where they're finding evidence that risk assessments are not taking place or not being done appropriately. And ultimately, that is a question of standards which could impact on the inspector's assessment overall of how the pharmacy is achieving the standards. But of course, the case for doing this and doing it well is overwhelmingly a positive case rather than a regulatory stick case. So I want to emphasize the positive case, but also highlight that it is part of meeting the regulator standards. Okay. So I hope, Jasmine, that's a useful scene setter with a bit of a regulatory take on it. I know you've got lots of useful information coming up later in the session. Yeah. I'm sorry, I think I might have frozen on the screen briefly earlier on. I hope that you've been able to follow most of what I've been saying. I'm happy to take any questions in the next couple of minutes.
Brilliant. So thank you, Duncan, very much for providing that comprehensive overview of the regulator's perspective on it. It's answered at least one or two of the questions that came through already. And if I may, we have had a couple of questions included in the Q&A panel. If I may just go through that with you.
Thank you.
So one of the questions from one of the attendees is, has the GPHC undertaken any intelligence-led inspections relating to pharmacy employers carrying out risk assessments or failing to?
I think the straightforward answer to that is I am not aware of that yet.
Okay.
I think it's something we are looking at. We have been doing some intelligence-led inspections on a range of topics, including COVID topics, but not exclusively. Okay. And it's definitely something that we will look at. So if anybody is concerned, seriously concerned that the right things are not happening and gets in touch with us, then that is an option. Equally, we are reaching out through our networks to a range of different stakeholders, including directly through our inspectors one-to-one into pharmacies to get a sense of what's happening. But of course, we're not systematically able to contact everybody all in one go. Okay. So intelligence-led inspections in relation to risk assessment is definitely an option and a very real one, although, as I say, it's not something that I think we've done yet.
Okay, no, thank you for that. Also, just to sort of build on the information about risk assessments for locums, I mean, we've obviously been asked this a lot of the times, and I think this was also a key question asked at the NHS England webinar last week on risk assessments. So you partly covered that already in terms of the expectation that, don't treat locums differently and, do the risk assessment with them to support the entire staff and patient safety. So the question which has arisen, and this may not sit with you, Duncan, but I'll ask that, is should locums, who are after all pharmacy registrants with the GPHC, should they do a self-assessment in terms of from their perspective, rather than just sort of leaving the onus on the person engaging them to provide the services?
I think that's a great question, actually. I think it's not necessarily for me to sort of go through the detail of the legal requirements, and some of your other speakers may be able to cover that. My understanding of the legal position in relation to health and safety legislation is that it's always the case that all workers, including self-employed locums, have an individual duty to take care themselves of their own health and safety and that of others who may be affected by their actions at work. So on that basis, I would have said that it would be a good idea to encourage self-employed locums to be assessing their own, as it were, intrinsic risk. I think where that then needs to sit alongside the environmental and workplace related risks that the owner of the pharmacy and those involved in managing and leading that pharmacy can fill that out, so that the intrinsic risk, as it were, related to the individual, which they're alive to, and the kind of environmental issues around that particular pharmacy can be brought together and looked at comprehensively. So I think I would definitely say it would be a good idea to encourage self-employed locums very much to be mindful of their own risk. They have, as I said, that, as we all do as workers, a legal duty to take care on their own behalf and also for others. So I think putting that all together, I think the questioner has identified a really useful idea, actually.
Brilliant. Thank you for that.
Jasmine?
Yes.
Hi, it's Nick. Perhaps if I could... Hi there, and thank you, Duncan. That was very well captured, and it is precisely the case. Self-employed persons, including locums, do have a duty of care to make a suitable and sufficient assessment of the risks that arise from their undertaking, and indeed risks to other people. I think the reality is that the locum would collaborate with the pharmacy and understand what COVID-19 measures are already in place, and that they are consistent with his or her expectations. And similarly, the pharmacy would be asking the same questions of the locum as well, so that both parties are satisfied that we're not introducing any further unnecessary risks, and both parties are adequately satisfied that the risk control measures proposed by both parties are suitable and sufficient. So, but absolutely right.
Brilliant. Thank you for that, Nick. That's very helpful. That's Nick Wilson from Ellis Whittam, and we'll be hearing more from Nick in a little while as well. Going back to Duncan, there's one more question that I think we'll be able to fit in before you have to leave us, Duncan. And very briefly, is this question keeps on coming up repeatedly, actually, is to say is what risk reduction measures can be taken for BAME staff in particular that would be different from those provided to the rest of the staff. And I appreciate it's a difficult one, because in terms of providing for the safety and risk mitigation measures, we are looking to sort of ensure that all staff are protected. But I wonder if this is something that the GPHC has come across or has any thoughts about.
I think it's a very good question. Yeah. I wouldn't, in the time available, to want to try to go into a lot of detail, but I think the starting point for answering that question anyway, as with, in a sense, with so many questions around COVID-19, is to be looking at the evidence. I think pharmacy as a profession, as I said, is well placed to assess evidence of risk. There is now a growing body of evidence from PHE reports and other resources as well about the nature of the risk. And I think we're all learning continuously about what measures can be taken. I think as well, it's important to be mindful not only of the, as it were, the extrinsic risk, if you like, but also the apprehension that many colleagues have about their feelings about risk. And obviously, if we feel unsafe, then ultimately we probably are unsafe in the sense that, you know, there is a risk to well-being, which we need to be mindful of. So I think this is why, one of the reasons why I think we need to be having these individual conversations with all of our colleagues, because there may be factors associated with age and sex and pre-existing medical conditions, whatever one's ethnic background. But for BAME colleagues in particular, because of the very wide level of knowledge and understanding now about the additional enhanced levels of risk, I think it's important to be mindful of the evidence as that continues to develop, but also of how people are feeling about the risk, which is, I think, a really important part of the jigsaw too.
Brilliant. No, thank you for that, Duncan. That's really helpful. So that brings us to the end of the session with you, Duncan. Thank you very, very much for joining us and providing some really helpful insights and responses to the Q&As as well. So thank you for that.
Thank you.
And hopefully speak with you soon again. Bye-bye.
Bye.
Bye. Thank you. Thank you, Simon. And Simon, if we can move on to the next slide, please, then I think we will continue with the program in terms of now talking about the NPA support available to members with regards to risk assessment resources. So if you could have the next slide, please, Simon. Thank you. So I think building on what Duncan has laid out a good foundation in terms of how risk assessments sit in the context of GPHC standards and things. I mean, as a sector, we are all acutely aware of the duty of care that is owed both to pharmacy staff and pharmacy patients. At the same time, we are also aware that death rates from COVID-19 are comparatively high among people in, BAME communities. And a large proportion of the pharmacy workforce come from BAME communities. So I think part and parcel of doing this individual risk assessments or having these conversations would be quite important to ensure that each individual staff member is supported on that one-to-one basis and they feel confident in engaging in the process and speaking up, ideally without any sort of cultural barriers in that sense, about having an honest and detailed conversation really between both the staff member and their employer. Now, pharmacies have remained on the front line. They've kept their doors open throughout the whole coronavirus pandemic, which is quite important to acknowledge, especially when we look at the number of GP practices who are operating behind closed doors. Pharmacies have become the focal point for members of the public to get healthcare services from. 63% of the population has visited a pharmacy during the lockdown period. So the level of interaction that pharmacy teams would have had with members of the public would generally mean that pharmacy teams are acutely aware of the risks, as well as having put in place a great deal of risk mitigation as well to protect against the risk of exposure to the virus. So at the NPA, we firmly believe that our role is to help pharmacies support them, provide them with practical support, and this is why we've developed our member resources, particularly the risk assessment and mitigation resources for workplace and individual risk assessments. If you could have the next slide, please, Simon. Thank you. So in the context of the NHS England and NHS Improvement individual risk assessments, you will all be aware that on the 24th of June, NHSE&I issued a letter asking for individual risk assessments to be deployed and completed within 4 weeks. And this was further highlighted in the NHS England webinar on 8th of July last week regarding this. And also a few days ago, we've had the SNAP service being initiated by NHS England through NHS BSA. And the intention of the two surveys is to track the progress made with primary care contractors, including community pharmacy, with regards to deploying and completing the risk assessments between the first and the second survey by the end of July. So thank you. Next slide, please, Simon. Thank you very much. This also links in all to the pharmacy quality scheme that's been announced just a couple of days ago. And you will all have seen that there are 14 essential criteria, all of them heavily COVID-19 related, with one declaration. And the majority of it is actually looking at things that pharmacy contractors and pharmacy teams would have already looked at and put in place key risk mitigation measures. So there's a link to our resources in terms of how we can support meeting that PQS criteria. The really important point to emphasize here is that completing PQS Part 1 is a gateway requirement to be able to participate in PQS Part 2 later this year. So it's really important that everybody engages with it to a high degree. If we could have the next slide, please. Thank you. Very briefly, these are the 14 criteria for PQS, which I'm sure you will have seen. And just to highlight in particular that the first of this covers workplace risk assessments, and the fourth covers the individual risk assessments, which we will be covering in a little bit more detail. So thank you for that, Simon. Next one, please. Right, so if I can briefly talk you through our main resources at the moment, is the workplace risk assessment is a very comprehensive tool that we've developed, which covers a lot of different areas of looking at things in the workplace, including risk factors posed by the working environment to pharmacy teams and the workforce, how to maintain social distancing, looking after hygiene measures, PPE, consultation rooms, and a whole host of things are covered in there. It also includes a standard operating procedure for hand hygiene with both soap and water and alcohol hand rub, including pictures and posters. I'll show them to you in a minute. And the brief sort of poster to sort of highlight the methods to prevent transmission, the do's and don'ts of how to protect yourselves. So if you could have the next slide, please, Simon. This is a very brief example of how we've laid out the resource. There are objectives on the left-hand column in terms of what do we want the desirable outcomes to be in terms of mitigating risks, and a chance to record in there what measures have already put in place in terms of the actions taken, what further actions could be taken, and sort of assigning a time frame to it. And this is to provide support for potentially regular ongoing workplace risk assessments as things change in the pharmacy, new services are provided, or just as a general means to ensure that everything is kept on top of, really. Next slide, please, Simon. Thank you. So this is a brief example of what the infection control page looks like on the left-hand side, what to do to prevent infection, what not to do, as well as the hand hygiene measures, which can be used as a tool to inform your staff and help spread the message about best practice in the workplace as well. Next slide, please, Simon. Thank you. So very briefly, then moving on to the individual risk assessment pack, which is what the key focus of our main queries is at the moment. This pack contains 7 different documents, and I will talk you through each of those in a little bit more detail as we go down. The first 3 documents are intended to be tailored by each pharmacy in terms of how you want to sort of use your details in them, as well as highlighting key information to staff. And they are meant to be issued to each member of the staff as a pack of 3 documents, which will inform the staff members regarding the risk factors, invite them for individual risk assessment by offering it to them, as well as ensuring that you have enough details received back from the staff member to be able to identify who falls in a BAME category and who's at risk potentially as well. The next 4 documents are, sorry, Simon, the next 4 documents are for employer use, and we'll talk through them in a little bit more detail now as well. Thank you, Simon. Next one, please. So this slide very briefly shows the first 3 documents. The one on the left is the template letter, which is intended to be tailored. It explains to your staff member your offer of the individual risk assessment, highlights the fact that there are certain risk factors which puts an individual at higher risk of developing severe illness due to COVID-19, and generally puts the invitation forward to engage in that process. The middle resource is an information fact sheet. This ties into proactively informing your staff members regarding what the main risk factors are, and it covers things like ethnicity, pregnancy, age, gender, all of that, with further signposting to read up more information about these risk factors from the recently published Public Health England reports as well about the disparities in risk of developing COVID-19. And the third form on the right-hand side, just near the NPA logo, is to collect the information from the individuals and for them to communicate back to you, indicating whether they fall in any of the vulnerable categories and whether they're accepting your offer for risk assessment or not. Next slide, please, Simon. Thank you. So here we have, going on to the next documents, which are the essential tools for the pharmacy, for the employer to use. So on the left-hand side, the 3 main documents, the 3 pages, contain a detailed risk assessment form, which the employer would use during their consultation. When you sit down to have that one-to-one discussion with your staff member to conduct the individual risk assessment, it goes into more detail about exactly what their medical condition might mean in terms of the type of support they require, what sort of risk does it pose to them, as well as recording, for example, in agreement between the 2 parties, what actions the employer has already taken, which they both parties have agreed will help to mitigate the risk of infection, but also to highlight to see whether any further action is still required to be taken and agree what those actions are, and to capture the notes of that discussion and for both parties to agree the next steps and the action plan for the way forward. To support that discussion for employees in particular, we've developed Form RA5, which is on the right-hand side, and that is the individual risk assessment matrix. That supports the employer to essentially look and try and gauge the risk to that individual based on both factors, their own individual risk of developing severe illness due to COVID-19, as well as based on their workplace risk assessment, how the two factors come together to highlight the overall sort of risks to the individual. And we've split this up into 4 different levels of priority, because individually, the people, your staff members who are at the highest risk are those who potentially have a medical condition which puts them in the shielding category according to the government criteria at the moment. The moderate risk is the clinically vulnerable category, which is also defined currently by the government as people having certain conditions, those aged over 70, pregnant women, and others with certain medical conditions. But even where your staff members don't fall into any one of those categories which are clearly defined, they may be predisposed to a higher risk because of other risk factors, such as generally increasing age, the fact that they are from a BAME ethnicity, obesity, other underlying health conditions, and that puts them at an increased risk, which is of a bright yellow category there. And then there'll be the staff members who are at low risk because they don't fall into any of those other higher risk categories. They're younger, they don't have other underlying health conditions, they're not pregnant, they're not obese, and they generally would be at a lower risk based on the current information in terms of the likelihood of developing severe illness due to COVID-19. And that needs to be taken into context against the workplace risk assessment in terms that, for example, if, for example, in a pharmacy, a workplace risk assessment hasn't been done at all, that would pose a very high risk to the individual, regardless of what individual risk category they fall into, because that might be the case that there's no risk mitigation measures have taken place, and it generally puts everybody at high risk. And I'm really hoping that there's not likely to be any pharmacy out there who would actually fall in that category right now. And then we've done that various, so the blue category is the low risk category, where a robust workplace risk assessment has taken place. There's robust risk mitigation measures in place already, including down to an individual level to try and lower that risk as much as possible to the individual. And furthermore, below that matrix, the document just shows what else is covered in additional guidance in there. Thank you, Simon. Next slide, please. So in this slide, we are looking at 2 other forms, the RA6 and RA7. The top one is the RA6, which just gives the background and the context of, the importance of risk assessments, how to conduct, making sure that, data protection considerations are taken into account. Further advice and support is available through the Health and Safety and Employment Advisory Service through Ellis Whittam, and as well as the process for conducting, the 5-step process for conducting a risk assessment. And on the 3rd page of RA6, the top document, we've included some tips in terms of how to conduct sensitive, meaningful risk assessments so that the conversation takes place in a sensitive manner, being mindful of the individual's feelings and how they can be reassured that they can speak up and share their, if they're apprehensive about anything, and just to have a good conversation with them. And the RA7 is the record-keeping form to support the data collection as well, which would help support you with the PQS as well as conduct the NHS-BSA SNAP surveys in that sense. Sorry, thank you. Next slide, please, Simon. Thank you. So the risk assessment resources, both the workplace and the individual ones, are available from the NPA website to download as packs. It's available. For any further questions, we do have a Q&A session at the end that we will address together with Ellis Whittam, or please feel free to email us at pharmacyservices@npa.co.uk. Thank you for that from my perspective. And if I can now introduce you to the Ellis Whittam team, with Laura Chalkley, Andrew Hall, and Nick Wilson, to discuss this in more detail from them, to talk about shielding, about returning to work, the general risk, vulnerable groups, and some commonly asked questions from their perspective as well. So thank you for that, and over to you, Nick and team.
Yes, that's the employment law section. You want to stop there, that's fine.
Yeah.
We had planned to do the health and safety presentation first because mine will sort of flow from there. But as the slides are here, I'll give you my overview first of all, and obviously we're available for any questions and answers at the end of the session as well. So essentially, obviously in the current crisis, there are a number of situations where employees who are not currently at work but fall outside of the statutory sick pay regulations, and they're relevant to the groups which Nick and Andy will come on to refer to later. Firstly, we have individuals who may be living with someone who has been advised to shield by the NHS, and they might be reluctant to attend work due to concerns about catching COVID and passing it on to a family member who is high risk. If they're not willing to attend work, this would not count as sickness absence and they do not qualify for SSP. If feasible, that individual can work from home, and this sort of employee could be furloughed, assuming that they've been furloughed for 3 consecutive weeks prior to the 30th of June. And also, in our case, subject to eligibility, as it's not a given for pharmacy, and we're aware that members have received mixed responses from HMRC regarding this. So I have referred to both furlough arrangements and otherwise, because having spoken to a number of members, there are some individuals who've contacted HMRC directly and have qualified, and I know are making use of that. So I will be referring to it during the presentation. There are some changes coming to shielding from the end of the month, which I'll discuss shortly. So actually this may be less of an issue moving forward. But in the meantime, it's much the same for those over 70s and those with underlying medical conditions who've been advised to practice stringent social distancing, or people having to stay at home to look after dependents. None of these people are off sick, so they should not be in receipt of SSP. And if you are intending to call them back to work and they don't want to return, we would strongly suggest taking advice about your options, as there could be potential discrimination issues at play here due to the protected characteristics. And pregnant employees are slightly different and have additional protections. Again, just to reiterate, if the employee cannot attend work due to the COVID-19 crisis because they're pregnant, that would not count as sick leave. And where they can't attend work for health and safety concerns, for example, because the workplace is considered to be unsafe due to COVID-19, they could work from home if possible, but also they may be entitled to full paid leave. If you currently have someone on furlough in this situation, it may well be advisable to top up their pay to 100%, given that they may have the right to fully paid leave in any event, something worth considering. Now just moving on to the next slide. And the one after that, please, Simon. Thank you. So as you may have already seen, from the 1st of August 2020, shielding will formally end in England. In Wales, that date is potentially the 16th of August, but that might change depending on further advice from the Chief Medical Officer for Wales, so we'll await further information on that. As a result, employees who've been shielding and who cannot work from home will be able to return to their workplaces. The government said that it recognises that employees may feel uncertain about returning to work, and it's calling on employers to ease the transition for their clinically extremely vulnerable employees, ensuring that robust measures are put in place for them to return to COVID-19 secure workplaces. Well, that in sort of grand terms is fairly vague and unhelpful. So the big question after the 1st of August is whether or not the employees can legitimately remain on furlough if you're making use of that, if the reason they cannot, why they cannot attend work, the fact that shielding no longer exists. We're recommending the following approach. So firstly, carry out an individual risk assessment to the shielding employee, which will take into account their specific circumstances and the associated workplace risks. If the risk assessment shows the employee cannot safely return, we think then it'd be permissible for them to remain on furlough if they're currently on it as an alternative. If they're not eligible for furlough and they are having to be suspended from work due to health and safety reasons, they will be entitled to full pay in that situation. If we as employers claim it's safe to return to work, having done our risk assessment, but the employee refuses to come back, find out why. It may be that the employee is able to provide specific medical advice confirming it's not safe for them to return to work, and in those circumstances we can continue to make use of furlough or sick pay depending on what they're currently off with. And if the employee produces a sick note confirming they're not fit to return to work, then again we can make use of furlough or statutory sick pay, whichever we're currently using. Again, past that conversation, we would recommend, getting the employee to speak to their GP for further advice, and then obviously we can go from there if they haven't already done so. Where things are in dispute with your employee about returning to work, and in the absence of any medical evidence, we think it would be prudent for you to contact HMRC directly to, if you are making use of furlough, to see whether you continue doing so. Because obviously with it being an HMRC managed scheme, and we're very mindful of the very mixed responses that members have been getting from HMRC, being as they're managing it, go to them directly to take further advice in that regard if you've already been making use of it to this point. In the absence of medical evidence or permission from HMRC for the employee to remain on furlough, you may be in a position where we have to force a return to work, or allowing the employee to take further unpaid leave if it's their preference to remain off if they're a bit nervous of returning, or they may want to use some holiday. However, word of caution here, if we're trying to force an employee to return to work when they have concerns about their health and safety or health and safety in the workplace, it is fraught with risk. They're in a protected category, and I will discuss that in a bit more detail shortly. If as actually conversely, if as an employer we have our own concerns about them returning and the fitness to do so, and the employee is otherwise saying, no, my GP said it's fine, I'm happy to return, I'm fit and well, I'm presenting as fit and well to return to work, then as an employer, if we're saying, well, no, we'd rather you took another X number of weeks off, they will be entitled to full pay in that situation, because that's something that we are imposing on them in that regard. Just moving on to the next slide then, let's look in a bit more detail about refusals to return to work. So now that lockdown's beginning to ease and many more workplaces, obviously we've been open throughout this, but there are other businesses who are reopening. We're trying to get people coming back to work who've currently been shielding or off work for other reasons. One issue is likely to come up is employees raise a concern that they don't want to come into work because they don't think it's safe to do so. So what are our options if this happens? Can you dock their pay? Could you discipline them? The answer really depends on a number of factors, and not least the additional protection that may be afforded to employees who raise such concerns. So the most commonly cited piece of legislation here is the Employment Rights Act, section 44 of that. That prevents an employer from subjecting an employee to a detriment if the employee does something on the grounds that they had a reasonable belief that the workplace presented a serious and imminent danger. And the protection is quite specific in that the employee needs to believe that they are in serious and imminent danger, and it's the employee's belief here that matters. So the question whether the belief is reasonable, so it doesn't have to be correct, nor does it matter the employee may not agree with them in their beliefs in that regard. If these elements are met, then taking any action against the employee, whether that be not paying them or even seeking to dismiss them, could fall foul of that protection. And if the employee was successful in bringing such a claim, damages can be awarded for loss of earnings and injury to feelings. So it's certainly, if you find yourself in this situation, it's certainly worth contacting the legal advice line, speaking to the team and taking further advice with regard to your own specific circumstances. Now let's move on to have a look at some practical steps. So again, we keep talking about it repeatedly, ensure you have place an up-to-date risk assessment. If we don't have one in place, that is going to make it difficult for you to defend any claim where we are pushing for a return to work if the employee is resistant and we're otherwise saying it's safe to do so. Once you have your risk assessment, put in place all those recommendations. It's all very good having the piece of paper. Actually take action and put in place the recommendations it suggests. And particular attention should be paid to those employees who have underlying medical conditions or are in those more protected categories, which Jasmine has referred to previously. Share with all your employees the details of the risk assessment and what steps you've taken. Communicate that. If steps are going to be taken at a later date for whatever reason, explain when this will happen and why there is a delay about doing that. If the employee raises a concern, find out what it is, sit down with them, talk to them about it. It's not a case of them just going blanketly, I'm not coming in, I'm not happy. Talk to them about it, find out, get to the crux of what their issues are. This can be approached sensitively, bearing in mind the remaining uncertainty about the whole situation. And we don't want to reprimand the employee for coming forward with those concerns. Listen to them, have that conversation and find a way forward. If you can, answer the concerns with objective evidence to support your assertion that the workplace is safe for the employee to return to. Set out what steps have been taken, and if any further measures that can be taken to assure safety, discuss with the employee and implement them. If the employee is still asserting that the workplace is not safe for them, establish why. Despite sharing this information with them, they still hold that view. Try to reassure them the dangers they've highlighted are not actually present and understand what is their remaining concern. If it is the employee still certain that they cannot continue to work, it will be at this point where we really have to consider our options. So what you could say is any period of absence from work in this regard is going to be unpaid, or we can take a firmer approach and explain that they'll be disciplined for unauthorised absence because we've otherwise spent that time establishing that it's safe for them to return to work. And this should absolutely really be the last resort though. And given it's a bit of a minefield, this area, we would always strongly recommend taking advice from the legal advice team before you take any such action, because stopping pay could be considered a detriment, and certainly dismissing someone for health and safety, raising health and safety concerns will be an automatically unfair dismissal. So we're doing some caution there. As I say, that was a bit of a sort of brief overview for the employment law issues. I'm mindful that obviously a lot of the guidance here is related to health and safety. I hope you find that this part of the presentation helpful, and we will be taking questions once the Andrew and Nick have completed their bit. So over to Andy and Nick.
Thank you, Laura. Next slide, please.
Okay, bear with me. Apologies, just trying to get that slide deck up for you.
That was a very helpful overview, Laura. Thank you for that. I think you covered some really interesting key points, which will address a lot of our member queries. And just to highlight, while we're waiting for the slides quickly as well, that NPA members, of course, have access to the advisory service provided through Elizabethum, both on the employment side of things as well as the health and safety side of things. So that's really helpful. And yes, we can go back to the slides again. Thank you. So over to you again, Nick and Andrew.
Good afternoon, everybody. My name is Andrew Hall, and I'm Health and Safety Regional Manager at Ellis Whittam. And I'm joined today by my colleague. I'll let him introduce himself. Nick?
Yes, hello, good afternoon, everyone. Nick Wilson, I'm the Director of Health and Safety Services at Ellis Whittam. I've given Andy the task of taking us through the slides, and I got the easy bit at the end, a couple of questions, and then the hard bit as we take your questions. So over to you, Andy.
Okay, thank you. Next slide, please. So what we'd like to do today is just, there's been a lot of conversation already with regards to where risk assessment sits in the importance of, managing the workplace, especially in regards to COVID-19. So I just want to take this opportunity to refresh people's memory about whether, the legal obligations sit with regards to risk assessment and other, management of health and safety in a wider regard. So the legal duties stem from the Health and Safety at Work Act 1974. It is business as usual in that regard. The directives within that act haven't been affected by COVID-19. They are still in place. The HSE and the local authority in your case will definitely expect that statutory obligations are still met regardless of the difficulties that COVID-19 may present. So we still have to, against the Act, provide a safe working environment for all our employees and anybody else who's going to be affected by our undertaking. So making sure that we are looking at reasonably practicable controls that are proportionate to the organisation that we are part of. And also making sure that we react and manage foreseeable risk. And obviously in a pharmacy, one of the biggest foreseeable risks is, could COVID-19 come through the front door? And absolutely is the answer to that question. So that if you look at the next bullet point, the management of health and safety at work regulations, and specifically regulation 3, bring into effect the requirement for an employer to make a suitable and sufficient assessment of risk of that working environment. And that means that all people who are going to be affected by that working environment need to be incorporated into that risk assessment. Excuse me. And the risk assessment needs to be accurate enough to ensure that you have selected the right, or the requisite controls that reflect current guidance, but also meet your local influences. And as was mentioned earlier by Duncan, a risk assessment template is exactly that. It needs to be bespoke to the environment in which it sits. So there may well be local influences that need to be built into that risk assessment assessment to make it suitable and sufficient. It also needs to be a documented record. The reason for that is obviously COVID-19 and the way in which we are learning about this virus. It's been fast changing. Since March, there's been release of guidance after guidance after guidance, and then the importance in making sure that that risk assessment is then updated as a result of that new release of guidance gives us the ability to keep the working environment safe. But documenting our way through this can clearly demonstrate to any regulator that you've made every effort to ensure that the working environment is safe and has maintained that improvement as the guidance has been adjusted. So making sure that the documented process is there also links into all of your the 5 principles that Duncan referred to earlier as well, but specifically principle 2, making sure that people are empowered and that they've got the knowledge to make sure that the working environment is safe. And so sharing that risk assessment in a documented way with everybody is an absolute integral part to make sure people are aware of the findings of that risk assessment and what's required of them. When we're talking about enforcement and penalties, regulators will be on hand, AHOs in your case, will be on hand to react to any instances where they feel working environments are not paying attention to health and safety legislation in its broadest form, but also the guidance put in place by the government around COVID-19. So, look, if you take RIDO for an example, reporting of injuries, diseases and dangerous occurrence regulations, COVID-19 now is incorporated in that legislation in that it's a workplace activity, not created by work activity, but certainly transmitted through work activity. And it is the risk of exposure that is the breach. So in certain instances, if we feel that we have potentially exposed an employee to the COVID virus, then the RIDO threshold may well be activated in that instance. So then we are then liaising directly with the regulators to tell them that our controls have failed. Also, there may well be complaints that are raised by other people. It may well be employees or members of the public that make a complaint to the regulators to say that our working environments, we're not observing social distancing, or there may well be other complaints that the regulators can then come in and investigate, and where they feel that a workplace hasn't followed health and safety legislation, then obviously penalties can be applied. Next slide, please. So, general risk assessment. There should be a general risk assessment of the risk from C19 transmission within the workplace. That risk assessment should cover every single person within that organisation in general terms. But it must also think about how other vulnerable groups may well be affected by that risk assessment and where there are required enhancements in those controls for those vulnerable groups or at-risk groups. So when the question has been asked, that does an individual risk assessment need to be completed for every single person in the premises? That is not the case. We need to do individual risk assessment where their requirements deem necessary. But our general risk assessment of that workplace, if it is accurate and bespoke to that particular environment, should, by definition, cover all those areas, and making sure that things like social distancing are maintained, 2 metre being the default and 1 metre plus being the mitigated control. Next slide, please. So where we have vulnerable groups, we need to remain aware of, in terms of COVID-19, how they are classified. So clinically extremely vulnerable people. These may be people who are on immunosuppressant medication, cancer patients. They're shielded until the 1st of August at this moment in time, where they may be working from home or not working at all. The employment law side of it, as Laura's just referred to. But as of the 1st of August, it may well be necessary then to make sure, or will be necessary then, to make sure that our risk assessment processes take into account the needs of any of these people who want to come back into work, who are unable to work from home, and that should be the default. But where they are unable to work from home, then we need to make sure that our risk assessments cater for their presence in the business and make sure social distancing requirements can still be afforded and keep them safe. Then there are clinically vulnerable, and these people can be in the workplace. So this is where the risk assessment process is absolutely vital to make sure that we've got the right controls in place to meet their enhanced needs. But vulnerable persons should be identified, and you're strongly encouraged to do individual risk assessments with these people. You can't compel anybody to take part in an individual risk assessment, and where there is a refusal, then we fall back to the general risk assessment, where the employer is then free to impose those controls on the people who they feel are in these vulnerable groups. Obviously, making sure that there's no discrimination, but making sure that we actively seek the controls that best meet their enhanced requirements. Next slide, please. So, higher risk groups I've mentioned, which are not categorised as clinically extremely vulnerable or clinically vulnerable. These could be people like older males, people with a high BMI, conditions such as diabetes, and obviously, as Duncan mentioned, the BAME, the black and ethnic minority backgrounds as well. And the scientific community is still debating as to whether that is because they represent a bigger proportion of the workforce, or whether there is a biological reason that they're more at risk. But if anybody feels that they are part of any of these particular higher risk groups, then it's very wise for the employer to take the initiative and do a vulnerable risk assessment with, or an individual risk assessment with that person. Is it necessary? No, but it is very, very wise to do that. And touching on something that was mentioned earlier about risk perception, this is key. If you know the management of COVID-19, there's a lot of stresses and there's a lot of anxiety around COVID-19, and making sure that people are confident in the controls that's in their workplace is absolutely vital to making sure that the well-being at work is catered for. Next slide, please. There has been questions raised about pregnant workers and whether it's you have to do additional risk assessments. Well, the NHSE say, although it is not a legal requirement for employers to conduct another specific or further individual risk assessment, employers may choose to do so. And again, I would always encourage people to take part in these risk assessments, because they then can feel that they're part of the decision-making process that make sure that the controls that they have available to them meet their enhanced needs. So employers can always take the initiative to drive that forward. But an important note on pregnant workers: if a pregnant worker has a significant heart disease, congenital or acquired, then this person will be classed as clinically extremely vulnerable under the current definition. So that is something to be aware of when you're carrying out these risk assessments. Next slide, please. Okay, so we got to some questions that have been posed to us in the past, and I'll just ask Nick for a response. What if an employee refuses to have an individual risk assessment undertaken?
Okay, well, thank you very much, Andy, and I'm pleased to discover that perhaps some of these questions have already been, if not partially or fully answered. But okay, as you mentioned earlier, you can't compel somebody to go through the process and sit with you and for you to conduct an individual risk assessment with them. You can't compel somebody to do anything for that matter. But of course, hopefully you've all heard a very strong and persuasive argument that the employer needs to put forward as to the reasons why they feel it is appropriate to carry out an individual risk assessment. And look, why are we doing this? What we're saying is that we've got a general risk assessment for COVID-19, but you fall into a particular category where you may be at a heightened level of risk. So we want to safeguard you and give you that reassurance that the risk control measures in our general risk assessment are going to adequately control any exposure that you may be presented with. So you're going to have to sort of exercise a different set of skills here. I mean, nobody likes to come down with a heavy-handed approach, turn to the legislation, whether it's the Health and Safety at Work Act or the management regs, which both include obligations placed on employees to cooperate with their employer. We don't want to go down that route. We want to go down the route of, look, it's the right thing to do. We're a responsible employer. We want to help you. We strongly suspect that the general measures that we already have in place will properly control your risks, but let's have a look. Let's have a talk about it. And it gives them that reassurance. Document the conversation, of course. You will need to say capture that discussion in the individual risk assessment if they agree to that. But if they choose not to, obviously document that. And you know, if it gets if it starts to sort of escalate a bit more, then you know, at that point you would then need to take advice. I mean, look at this very simply, right? The exposure and the risk of contracting this is essentially presented by two things. You've got to come into close contact, proximity with someone who's carrying the virus. You then contract it through, you know, an aerosol or touching something, contaminated surface. So it's social distancing is most important. Hygiene is absolutely important, but also consider those activities that may bring these high-risk people into contact with potential people who can transmit. I'll save you the job of reading the next question, Andy, because I think it's already been captured well by both yourself and Laura, and that is the question pertaining to those who are currently shielding, who will be allowed, as from the 1st of August in England, certainly, to return to the workplace. Again, it's another community where you have to look at your measures. My strong recommendation in the first instance is always to explore the best form of risk control, which is eliminate the exposure. In other words, can the individual continue to work from home? Right, it's eliminating exposure through work activity, of course, not through other personal behaviors and habits and that. So can they work at home? If not, we know they are permitted to come into work. Again, so it's revisiting your risk assessment, social distancing, hand hygiene, even exploring other things, perhaps personal protective equipment, the erection of screens, and so on and so forth. Finally, just a further reminder of the advice and the support that is available to all of you through Ellis Whittam. There's the NPA Advisory Service, together with one-to-one support services tended through email and telephone support provided both by our employment lawyers, Laura and her colleagues, and of course my team in the health and safety. I think next slide, please, takes us to just a summary and a reminder to you all of where you can access those resources, including our COVID-19 hub, which got a raft of material, documents, templates, risk assessments, and that you can take hold of. But importantly, as Andy says, modify it so it reflects your environment and your activities. So that's it from Andy, myself, and Laura. Jasmine, are you going to take over from now?
Yes, thank you, Nick. That's really very helpful. Thank you to all three of you for providing a comprehensive overview about health and safety aspects of this and the employment law aspects of this. We have, if you can move on to the Q&A session now quickly, we've had sort of some questions come through which really resonate with what else I've noted as well. So if you can go through those next, that'd be really helpful. There's a couple of key questions come through on furloughing in terms of furlough of shielded employees or those who may have some childcare commitment issues. So the first question on furlough is, can you apply to furlough retrospectively formerly shielded employees? So for example, because the furlough rules seem to have changed quite a bit over the course of the pandemic. So for example, a staff member who was paid statutory sick pay during a shielding period following consultation and who is now back at work, can a retrospective claim be made to furlough them? Sorry, Laura, you're on mute. We need to unmute you.
There we go.
Yeah, sorry, that's better.
No, it might be
you.
worth a call to HMRC, but as far as I'm aware, the cut-off was that was 10th of June. So the individual would have had to claim furlough from this point onwards. That individual would have had to have been furloughed. So I agree with the employee. That's what they're being paid by 80% of their salary, and that would have had to, because it would have had to have been furloughed for 3 consecutive weeks by the 30th of June. So that date is now passed, unfortunately. So we haven't already done that, and likely be able to put a claim in now. But HMRC managed the scheme. You're quite right, there was a lot of confusion.
Yes.
We had both the guidance from the government, and we had a Treasury direction which was an issue which didn't tie in with that directly. It talked about if you're on sick pay, you can't be furloughed. So there's a direct contradiction there. And we are aware of, and that was in relation to people who were shielding, but we're aware of HMRC permitting furlough payments for those who were shielding. So it wasn't entirely clear. So it might be worth clarification with HMRC, but I think they may say that the cut-off date has now passed on that one.
Okay, thank you. And furthermore, on the furloughing theme again still, what would be the case if a member of staff asks to be furloughed because they don't have anyone to look after their children due to childcare issues? I mean, how can their employer support them, and would that be permitted by the HMRC?
Okay, so again, same cut-off rules would apply there in terms of whether we actually use this not just far, but we're getting a lot of queries around childcare, aware it's an issue. Obviously, an issue with the schools closing, etc. It's getting, and originally, actually, yes, if somebody was struggling with childcare and was having to take absence due to that, because it was related to the COVID-19 outbreak, they could be on furlough for that reason, if that was the reason for their absence. It's becoming less of a need now, because obviously there are some nurseries and school opening. Obviously, pharmacy staff we consider key workers. They can make use of that, and obviously we're now allowed to blend households, have our bubbles, so those people who couldn't rely on grandparents, for example, previously now can do. So it should be less of a COVID related reason. So if it's not, if people are still struggling with childcare otherwise, or we feel they may be a bit resistant to use the options available to them, it's again worth a conversation with that individual. If they have other needs which aren't COVID related, then really they should be applying to use annual leave or parental leave in the same way they would need to use care for during the summer holidays anyway.
Brilliant. Thank you. And some other questions coming in, because I'm sure everybody's heard, it's been in the news quite a bit in the last couple of days about wearing a mask or face covering as a mandatory measure, when entering premises, including pharmacy. And there's a couple of questions being asked from both different angles. So, shoppers have to wear a mask or some similar from the 24th of July. But it's not necessarily mandated that those working in those premises necessarily have to wear a mask. So in terms of risk mitigation, where would one stand on that? So should it be mandated that all staff in a pharmacy, for example, or recommended that they all wear a mask in terms of the expectation of the members of the public coming in with that expectation that they need to wear a mask?
That's probably one for Nick and Andy if they want to pick that one up.
Sure, thank you.
Well, it does seem rather peculiar, doesn't it, that from the 24th of July, and indeed at this current moment in time, shoppers are required to pay face coverings, but not the staff. Having done the odd bit of shopping myself over the last couple of weeks, I have to say that almost every shop assistant that I've encountered has been wearing a mask, but it doesn't answer the question, does it? And that is, can you essentially obligate one of your employees to wear a mask if they are not already doing so? And the answer to that question at the moment is no, you can't. I think we'll all have our own views on whether that's right or wrong. For me, I can't understand the logic behind that. I know masks don't afford you protection, or rather face coverings don't afford you protection. They afford others protection, but I would be far more comfortable in an environment where both I and the people I'm interacting with are wearing one, notwithstanding its limited benefits. We all have to wear one on public transport. I don't know, what do you think, Andy? Or can you make sense of it?
There's something else to consider here as well. I mean, the default position on social distancing is 2 meters. And if you drop below 2 meters, then it's 1 meter plus mitigation. And in most pharmacies I've been in, people will come in closer contact than 2 meters. So I think on that basis, I would strongly advocate the use of face masks.
Thank you. Also, on the other side of things, there are equally pharmacies who have sort of introduced the policy or introduced the risk mitigation measures among their teams, where they're advising them that all staff members do wear a mask, when they are working on the premises. And the question has been raised is, and this has happened a few times, is what can one do if a staff member refuses to wear a mask in terms of well, either implications on protecting themselves versus implications on protecting others. And a question's been asked a couple of times now to say, can they sort of sign some sort of a disclaimer or waiver to say, I'm okay to not wearing a mask, but that's more for their protection. I would say, how can we look at it in terms of protecting other members of the staff if one of them is choosing not to wear it? Or is it, I mean, we've got to be mindful that there are exceptions, isn't it? That not everybody can potentially be able to wear a mask for prolonged periods of time, like even a whole session, if they have other considerations to take into account, because even for wearing masks in public transport, for example, there are exemptions. So how does one approach that?
Well, while you have a think about that, Andy, let me give you the legislative answer to that question. And that is as follows. And let us put to one side those who may be exempt for whatever reason for wearing a mask. And we are just considering here an individual who just sort of point blank refuses to wear one. Yeah, there is an obligation contained within the Health and Safety at Work Act. It's placed upon the employer to do everything that is reasonably practicable to safeguard its employees and others. And then further down in the Health and Safety at Work Act, you then discover a duty that is imposed on every employee. And that duty is to take reasonable care for their health and safety. And the second part is, as far as any duty that is required on the employer is concerned, the employee shall cooperate with the employer so far as is necessary to allow the employer to fulfill that duty. So I'm the employer. I have, through my risk assessment, determined that there are items of PPE that I want you to wear. The traditional forms, boots, gloves, hard hat that we see all the time. Now I'm stipulating that you wear a face covering, because in my estimation, that's going to mitigate the risk of COVID-19 transmission. You're refusing to do it. You're failing to cooperate with me and allow me to fulfill my legal obligation as an employer. I think there's a bit of a discussion to be had. But again, you don't want to go down the stick approach when you can avoid it with some other sensible adult conversation. But ultimately, that is the duty. I mean, there's a similar duty in the management regulations as well. So Section 7 of the Act, or Regulation 14 of the management regs, if you're interested.
I completely agree on that point, Nick. However, I do think that there is an element where an individual risk assessment comes into play here. And if it is a person, as you mentioned, Jasmine, that is unable to wear a face covering for whatever reason, it may well be, other practical applications, face visors. They protect other people as well. Don't protect the wearer, but they protect other people from, any droplets that the wearer may exhale. So, there's always that practical solution, but essentially, as Nick said, the employee has an obligation to cooperate to make sure that their employer's role is being carried out correctly.
Brilliant. No, thank you for that. That helps answer this frequent question. Next one is more of an operational practical level in terms of conducting the actual individual risk assessment or having those conversations. I would assume that there was nothing saying that they has to be done in person, face to face, that it's perfectly acceptable to do it by phone or by video chat or any other means. The main thing is that you're having that conversation. Would that be right, or is there anything more to it than that?
Absolutely, yeah. There's no there's no requirement for risk assessments to be carried out in person in that regard. I think so long as the right information is discussed and the requisite controls are arrived at.
Brilliant. No, thank you.
I think there's probably more effective ways of collaborating with somebody than over the phone.
Okay.
I mean, share the first draft of the risk assessment by email, perhaps,
Right.
until you arrive at the point where both sides are happy with it. But yeah, I mean, it doesn't have to be face-to-face. And let's face it, sometimes situations demand a risk assessment be brought into existence pretty damn quick, and we don't have the opportunity to sit with somebody and develop it. So.
And I think also this comes into the context that, at the moment with, as Laura mentioned earlier, with the shielding rules changing from August, certainly there are pharmacy teams at the moment looking to conduct those risk assessments with their staff members who are currently at home and shielding, and they're seeking to make sure that that happens, and that's likely to be done virtually or remotely at the moment. Because what they're trying to gauge is it okay for them to actually return to the pharmacy premises? So I'm assuming that that way is fine, and it's best thing is to take an approach in terms of a mixture of different ways of communicating to bring about the best result, really.
Yeah, that's right. And I noticed one of the slides earlier featured a screenshot of the Back to Business document that Ellis Whittam have developed. And that very much is, well, it's talking, it does what it says on the tin. It's preparing to return to work, and no nasty surprises the moment that you unlock the door and everybody piles back in. There's got to be a lot of discussion before that to reassure people that things are in place.
Yeah.
So yeah, common sense determines that. Yeah.
I think if people are coming back from shielding, the reasons for their shielding are medically defined and very clear,
Yes.
which then makes the risk assessment of that and picking the right controls that much easier.
Yeah,
I think that as long as that's shared prior to setting foot on the premises, then that's the key.
Brilliant, thank you. And another question, and this is not this time also on the shielding theme, but not about shielded members of their staff, but any sort of best ways, I guess, or thoughts regarding how to deal or manage patients coming into their pharmacy who might be in that shielded or higher risk clinically vulnerable category, in terms of any specific measures or risk mitigation measures that need to be put in place for the patients who are in that category, not just their staff members.
I'm not. Do you operate on appointment systems, or would that be something that could be considered? Because if you do have a period of the day that you can close the doors to general public, but by appointment only, that would be a solution, as GP practices have done. I think I'm not saying that would fit every pharmacy, but I think it's making sure that you can actually try and invite people in proactively at periods of the day when they're not going to be exposed to to larger amounts of footfall. That would be one example I would come up.
No, that's very helpful. And in terms of the actual risk assessments, I mean, the way sort of our risk assessment pack has been developed, which you've seen, is that the individual risk assessment is meant to be offered to all of your staff, regardless of whether it's known from the outset whether they are in a higher risk category or whether they're more at risk or or BAME. So I would say, I mean, do you have any further sort of thoughts on that? Because the intention would be that every member of your team is offered that individual risk assessment. Is that right?
Well, it's not necessary.
Right.
As captured in Andy's slide earlier about the general risk assessment is intended to cover the majority of people. Well, sorry, it covers everybody, full stop.
Yeah.
And that is what the law requires. Our strong recommendation, and indeed one that you have promoted amongst your members, is that individual risk assessments are conducted, but it is for vulnerable persons, for those identified at higher risk. So if we strip out those who do not fall into those categories, for me, it isn't it is not necessary to conduct an individual risk assessment, nor in my view, is it necessary for you to invite them, invite the opportunity for them to have an individual risk assessment carried out on them. But, you know, at the risk of saying something that contradicts what you have put out there to your members, you know, that may well be a position that you have taken, which is fine. But, you know, from a legal angle, health and safety legal angle, you don't have to conduct a risk assessment on any individual. In fact, the only times you discover the requirement to conduct individual risk assessments on the health and safety law are where you have a young worker under 18 or expectant mother.
Yeah.
I don't know, Andy, if you correct me if there's any others that you can think, but
absolutely right. I think education is key here, and as long as people, and going back to, you know, principle 2 of the GPHC 5 principles, you know, education and empowerment here is key. Making sure that people understand the risk controls that are available to them will negate the need for individual risk assessments when they don't fall into a higher risk category or vulnerable. And that's the way I would go. I think you're doing the right thing in sharing all the information that's freely available, which is brilliant. But you know, I think we could go overkill very quickly by doing assessments with every individual.
So the thing where we are coming from is, obviously you will be aware of the NHS England's letters out to primary care contractors regarding individual risk assessments, and what they're now conducting survey is they're checking to ensure that primary care contractors have offered a individual risk assessment to all staff, essentially. And what their letters to the contractors has been that they were asked to deploy and complete individual risk assessments and at least offer them to all staff, which has become part of the, you know, from the NHS side of things, I guess, which is a little bit different from the health and safety legislative viewpoint. So I think for us, it's in terms of the resource that we've developed and the resources, it's been balancing those requirements so that, you know, we are supporting members equally in terms of sort of being able to comply with that NHS asks, as well as making sure that they're supported from, you know, your perspective, from the health and safety perspective as well. So I think if we can have the next slide, please, Simon, if it's possible, please. So first of all, thank you for helping to address those questions. In terms of the NPA resource, the intention of it is, as I went through the different 7 different documents, is it supports you pharmacy owners as employers to be able to inform their staff members of the risks posed and the specific risk factors which predispose them to a higher risk of severe illness from COVID-19, and to be able to offer that individual risk assessment and then sort of to conduct it, you know, where they've identified the BAME staff or those at risk and those who, you know, accepted their offer, essentially. Sitting alongside the workplace risk assessment, which is a mandatory requirement, essentially. So I think that addresses all of the questions we have had coming through at the moment. I would just like to re-highlight again the availability of the resource. And Simon, if you can go to the second last slide, please, in my presentation, which also contains the, yep, that one, please, thank you. The contact details for Ellis Whittam, where NPA members can actually contact the Ellis Whittam team for further advice and support. That'd be helpful as well. And I would like to thank you again, Duncan, for his time with us and sharing the regulator's perspective, and the Ellis Whittam team, Nick, Andrew, Laura, for giving a very comprehensive and thorough overview and highlighting also to pharmacists that the type and level of information and support that is available through your team. So thank you very much for that as well. Thank you for joining me. And Simon, if you can have the next slide, please. I would just like to highlight, of course, to our listeners as well today, that the next session in the NPA conference takes place this evening from 7:30 to 9 p.m. regarding the right review. And the question we are posing is, does the right review deliver for independent community pharmacy today and prepare us for a better tomorrow? and that is being hosted by Michael Lennox, a NPA Local Integration Lead, Jay Badenhorst, who's an NPA board member and a contractor himself, David Bierman from Devon LPC and is on the right steering group member, James Wood from Surrey and Sussex LPCs, and Kath Coulson from Lancashire LPC. So please do join us for that session this evening if you can. Thank you all for listening today, and have a good day. Thank you all.